Hey guys, Dr. Bodle here, and today we're going to discuss the usage of the supplement diindolylmethane, also known as DIM, within the context of hypothyroid conditions. Now, DIM is a compound that we can get from cruciferous plants, including things like Brussels sprouts, kale, collard greens, broccoli, cauliflower, and turnips. Within these plants, there is a compound called glucobrasicin, but don't quote me on that pronunciation because I'm not exactly sure. Eventually, glucobrasicin is broken down into a few different compounds, including something called indole 3 carbinol. When indole 3 carbinol hits our stomach, the acid in our stomach causes it to undergo a process called dimerization. Essentially, two indole 3 carbinol molecules are fused together, and that creates the product called DIM. DIM is more stable than indole 3 carbinol, and whether we take a supplement with indole 3 carbinol or DIM, what we find is that levels of DIM are elevated in our bloodstream and in our urine metabolites, and we don't see any increases within the body of indole 3 carbinol. This leads us to believe that DIM is one of the more active compounds that we receive from these cruciferous vegetables, although there are likely other components that play a role in our health as well. Because diindolylmethane, every time I get that right, I just want to clip that part and use it every single time I say it in this video because I'm not getting it right every time. But anyways, because diindolylmethane is the more stable of these compounds, and because it's the one that we can measure within the system, it's the compound that has garnered the most attention within the research, and that's also why it's been formulated for supplemental use. Now we know that when it comes to changes in thyroid function, we can also have changes in the health of our sex hormones. And this can include the production of sex hormones, the utilization of sex hormones, and the clearance of sex hormones once they need to be broken down and removed from the body. However, because these interactions are multifactorial, we can't always say that low thyroid function always leads to a specific constellation of issues with our sex hormones. But we do know that in some cases, based on the circumstances, it can lead to an increase in estrogenic activity or an increase in our estrogen levels overall. As I said, we may have a difficult time removing estrogen and estrogen metabolites from our system, which can lead to an overall accumulation. And for people with hypothyroidism who have an increase in body weight, we know that fat cells can produce hormones and hormone-like substances that can interact with our estrogen receptors and also contribute to that overall estrogenic load. For some people, you may be able to measure higher levels of total estrogens or estradiol on your blood labs. And that would give you a clear-cut answer to whether or not higher levels of estrogen could be contributing to some of your symptoms. Unfortunately, it's not always that easy. And sometimes people don't have overt increases in estrogen, but instead their estrogen is high relative to some of their other sex hormones. I will occasionally use month-long salivary testing to get a better idea of what our hormones look like, but most often I'll assess things based on someone's history and the presentation of their current symptoms. Signs that suggest we could have too much estrogen include things like heavy periods and heavy cramping, irregular period timing, weight gain especially around your period, or difficulty losing weight after we've attended to things like nutrition and lifestyle, significant increases in pain with your period, increased irritability, increased emotionality, and possibly depression. Additionally, estrogen can play a role in combination with testosterone within the context of PCOS. And those changes in estrogen levels may also be associated with things like acne along the jawline, increased facial and body hair growth, and again, some of those menstrual cycle irregularities. On top of all that, I'm also always curious to find out if someone has had a bad reaction to taking birth control that is estrogen based, or they've done hormone replacement therapy that includes estrogen as a part of it. Feeling worse initially, or utilizing those therapies over a long period of time could both indicate that we have higher levels of estrogen within the system. But real quick, before we talk about how DIM can be helpful in these situations, I wanted to remind you that if you're someone with Hashimoto's and you're feeling exhausted, overwhelmed, and you're not getting the help that you need, you can reach out to me about my online course, Natural Hashimoto's Transformation, by sending an email to contact@seattlethyroidhelp.com. The course includes 8 educational modules and live weekly question and answer sessions to make sure you're getting the help that you need. By the end of it, you'll be making real changes to actually improve your symptoms, and you'll know exactly what you should be doing in regards to nutrition, lifestyle, and supplementation that is specific for your needs and your Hashimoto's. But with that said, let's get back to the video. So if you do have a history of thyroid problems and you think that it could be contributing to some issues with estrogen, how can DIM be helpful? Well, it's pretty cool actually. DIM can interact with some of our receptors that affects the way we break down estrogen. It upregulates certain estrogen metabolites that are more favorable and supportive to us, and it downregulates the ones that have more potential to cause harm. This can modulate the overall activity of estrogen within our body and help bring down some of those pro-estrogenic effects. Additionally, DIM may inhibit the enzyme aromatase. Now, aromatase is what our body uses to convert testosterone into estrogen. So by reducing that enzyme's activity, we can actually reduce the overall amount of estrogen. In addition to changing the levels of estrogen and modulating the way estrogen affects our cells, DIM might also have some anti-biofilm activity. And for those of you who don't know, certain types of infectious organisms will sometimes create what is known as a biofilm to help protect them and hide them from our immune system. Breaking down these biofilms then lets our immune system actually get to that infectious organism and get rid of it from the body. DIM might also inhibit the production of new fat cells, a process which is called adipogenesis. And finally, DIM might have some anti-cancer effects and reduce the likelihood of cancers like breast cancer, endometrial cancer, hepatic cancer, thyroid cancer, and prostate cancer. But even though some of these effects are still in the early stages of research, we still know that the impact on estrogen itself is something that's real and something that can be quantified. So how do we apply that to a clinical setting? So as I said, we can get DIM naturally from cruciferous vegetables. So why don't we just eat those? Well, we certainly can, but within the context of hypothyroidism and the disease process, it might be too low of levels if we're looking to elicit a more ready change. For example, 100 grams of broccoli includes about 30 milligrams of glucobrasicin, and that breaks down to about 2 milligrams of DIM. When it comes to the research, we see the studies using anywhere from 75 milligrams all the way up to 300 milligrams per day. So it might be a little tricky getting that amount of DIM from food itself. In general, I like people to start with 100 milligrams per day, but I wanted to provide you with the whole range because taking less also could be effective. If taking 100 milligrams per day for at least a week is well tolerated, then it's possible I could increase that person to 100 milligrams 2 times per day to see if we get some additional benefit. What I'm looking for is a reduction in all those symptoms that I mentioned earlier. And although changes in hormones can take time, I want to look for small improvements and indicators on a 30-day basis. That way we can confirm that we're on the right track and we know to continue with the therapy. Now, with all that said, here's the thing that we need to be careful of. Even if we have a number of signs that suggest that sex hormones are playing a role in our symptoms and they need to be supported and addressed, that doesn't mean that DIM will be the answer for everybody. It's an option, sure, but because it interacts with our body in a multitude of ways, it's sometimes hard for us to predict exactly what that outcome is going to look like until we start taking the particular supplement. Can people have great success with DIM? Yes, but in certain people, it can also make some of their estrogen symptoms worse. When we initially start a supplement that can impact our hormones, it's normal to see a slight uptick in symptoms for a few days all the way up to a week. And I'm usually looking for an increase in headaches and GI distress, which is shown in the literature. But I'm also keeping a really close eye on anything that could be related to changes in estrogen. So if you suddenly feel like crying at just about anything, or if you become more depressed, or if you find that you're extremely irritable and have a very short fuse. You could also notice more bloating around the midsection, or an increase in acne and an increase in hair loss. Again, if these are mild changes and they start to resolve, that might not be a problem for us, and it could be an indicator that the supplement is working. But if the change in symptoms is severe and it starts to get worse, then utilizing DIM is probably not the best choice for you, and we'll want to look at other options and other ways to support your hormones. As always, there are no magic supplements, and it's most important to find what fits with your physiology, and we do that by understanding those root causes and mechanisms. That way, if one compound that you're using doesn't work for you, we'll say, you know what, no problem. We're going to switch to something else that has a focus in this same area of physiology, and hopefully we can support it in a better way. But as always, I hope that you liked this video and found it interesting. And if you have any questions, or if you've used DIM before and have experience with it, feel free to share those thoughts in the comments below. Also, don't forget, if you're looking to learn more about Hashimoto's and hypothyroidism, you can grab either one of my free downloads in the description box below. You can follow me on Instagram or Facebook, or you can check out any of the other videos right here on my YouTube channel. But that's it for this one. I love you guys. I hope you're doing well. Thank you for continuing to like these videos, subscribe, and support the channel in general. But my name is Dr. Bodle. I hope you have an excellent rest of your week, and I will see you in the next one.